My name is Lucy Duffy, and I'm the Vice President of Perioperative Services here at Mount Sinai. I was diagnosed on July 20th of 2015, so 7 months after I started here, which was a little nerve-wracking for me because I was a new employee and I was really worried about my job, and I'm a single person, so supporting myself, being out to work, and I had all the fears that a normal employee would have of, will I get fired? Will I have a job when I come back? Will I come back? So all of those fears were immediately real for me. And I spoke to my boss, Michael McCary. He's the Senior Vice President of Periop, and he was fabulous. I think that's the only time I cried was speaking to him. And he assured me right away, just take care of yourself, your job will be here when you get back, and I trusted in him. I had my mammogram done at the old hospital I worked at in New Jersey, and they called me back 2 weeks later to tell me that I had something that needed to be biopsied, and it really was not a friendly communication. It was very hard to get information from them or even to schedule myself. When I couldn't get my biopsy done before I went away, I called Melissa Bellino, who's now the Vice President of Cancer Services here at Mount Sinai, and I only met her once or twice at a meeting. And I asked her, is there any way I can get my biopsy done before I go on vacation? And she told me how to do everything. I had my films sent over, my reports sent over, and she received them on a Wednesday. And by Friday afternoon, I had my biopsy done right before I left for Toronto. And then I got my diagnosis while I was away on my vacation. But I never once doubted that I would come here after I started the process because, everyone was very accommodating. I felt like I was receiving individualized care. So I knew it was something that I shouldn't wait on. I should act and have my surgery, and I went to see Dr. Elisa Port here at Mount Sinai, and she was fabulous and still is. The morning of, my staff were surprised to see me as a patient, and I wasn't trying to hide anything from them. I just didn't want them to treat me any differently than all the other patients that we care for here. I am a patient like any other patient, so I pretty much kept my identity to myself, and I just wanted to be a patient. That's the other thing. I just went into patient mode, and I didn't ask questions, appropriate questions, but I really trusted in everyone else to provide care for me and not try to manage everything or tell everybody what to do. I just accepted care and tried to be a good patient. I've always been a very grateful person in my life. This just accentuates how from one day to the next, anyone's life can change. Every day, I always know that I had cancer, but I just, keep moving forward, and hopefully it will never come back. If someone was seeking employment at Mount Sinai, I would just say be open to any opportunity, because there's so many possibilities here. It's bigger than just Mount Sinai. We're a system of 7 hospitals. So any way that, may not be your dream job initially, but just to get your foot in the door and experience what Mount Sinai has to offer. Getting the care that I received with kindness, compassion, and just attention to making sure I was comfortable, free of pain, and that, I progressed properly was really an outstanding experience for me, and I'm just very proud to be working here.